Hello everyone. My name is Jacob Frank, and I'm here to present healthcare affordability in Rwanda. As you can see here in the first slide, there's a picture of a woman and many children who cannot afford to pay their medical bills. Yeah. And on the next slide, there's the topic says current healthcare landscape. The overview of Rwanda's health system. Rwanda's healthcare system has made significant strides with community-based insurance schemes improving access for money. However, affordability remains a challenge for numerous families across the country. Basically, here what they are saying is even though the country is evolving, there are some people who are still struggling to pay their bill because maybe they don't have jobs that are good enough to pay the whole bill. And yeah, they are here. There's a landscape being put together to make a way for them to reduce the money they should pay for their medical bill. Yeah, thank you. That's the now next to the third slide where there is factors affecting affordability. Understanding Rwanda's healthcare challenge. There is economy. As we know, Rwanda has been through a rough patch and the genocide of 1994. So, the economy had to get down, and we as Rwandan, we are trying to build it back, but we're not on our best. So, on economic, it says economic factors like income levels and high poverty rates greatly impact healthcare affordability, forcing many families to choose between essential needs and medical expenses. So, because of their jobs and the economy of Rwanda are still low, basically the income that they get is low compared to the amount of money they have to pay for their bill, for their medical bill. So, because of the economy that is still low, they can't pay them a higher salary so that they can cover the whole bill. And next, there is systematic challenges such as limited government policies and inadequate insurance coverage hinder access to necessary healthcare services, affecting overall population health and well-being. So, such as it says here, such as a limited government policy, the insurance of that are available here in Rwanda, they don't cover the whole bill. So it means like they pay like, for example, they pay like 20% and then you pay the rest. That means if it's like an operation, they pay only 20%, and operations are the bill is high. So if it's 20%, the 80% that is not paid yet is going to be a lot of money. So it's not easy for someone who has low income levels to pay it, and it's really a big issue. And the lastly, there is geographic disparities create significant inequalities in healthcare access, with rural communities often facing higher costs and fewer available resources compared to urban areas. So here, rural areas, as you know, Rwanda is a high hills country, and some rural areas, it's very, very difficult to reach there to take their materials for medical assistance. Sometimes it's even very difficult to take a sick person to the hospital. They have to use like things to carry them on. There's a place where in Rwanda where the ambulance cannot reach, so they have to carry them maybe on their shoulders, maybe on a raft, so that they can get them over where the ambulance is waiting for them, where the ambulance can pass. So that's a big issue that we can face, that they are facing. Yeah, and next slide is impacts of affordability, health outcomes, social impact, and personal stories. And on health incomes, delayed treatment leads to preventable diseases and increased mortality rates among vulnerable population. So health outcomes means you know there's some because it's hard to pay the bill. They delay and stay at home thinking that they'll get better by days, and then the illness become a big issue, and they can't you know they get to a level where they can't treat it. That's how they do it because they can't pay the whole bill. And on social impacts, economic strain from health costs results in reduced productivity and financial instability for families. Health costs, people can really choose to pay the fee for the medical bill. But at the end, after paying the medical bill, they found that their money is gone. They still have no money to take care of their families, and that will create a financial instability in their family. Personal stories. Personal experience highlight the urgent need for improved access to affordability healthcare solutions. So personal stories, maybe there are some people here in Rwanda who still don't believe that it's needed to go to the hospital. So that will really affect the healthcare. They really don't want to go to the hospital because they think they can do better by themselves. But basically, they don't want to go there because it is still a big expense to cover. And on the next slide, there's solution and recommendation. There are basically government initiatives like expanding health insurance, improves access for all citizens, community program, preventive care initiative help reduce complications, and there's international aid partnership with support Rwanda's health projects and resources such as USAID that helps, and case studies, successful programs show effective models of sustainability. Yeah, basically here on international aid, basically some aids that will help them, you know, treat people for free, like USAID, like many international aid that we have to find them. And thank you for giving me the time to present you my project. And here are the links that you can use to search up my where I found my research. There is National Institute of Statistics of Rwanda, and there is Ministry of Health Rwanda. Thank you very much.